Radio Now 100.9's Indy Connection with Emily Metheny.
Hello, I'm Emily Metheny, your host. On February 26th, I had the chance to speak with Dr. Lana Dbeibo again. If you remember from our last conversation earlier this year, she's an infectious disease physician with Indiana University Health. To start our talk this time, I asked Dr. Debeibo to briefly recap what a vaccine is, before jumping into how immunity works and some other important information.
So vaccines are actually one of the probably best things that we have to prevent us from getting infections. So they are a way to ready our bodies to be armed with everything they need to fight off certain infections. As you know, that one of the reasons for why the COVID pandemic has been so bad is because none of us has ever been exposed to COVID before. So we do not have the capability to actually fight off this new infectious agent that our body has never seen before. And because our body, it takes it many weeks to start producing those antibodies to fight off infections. Many people are suffering from a lot of serious illnesses from COVID. Vaccines, what they do is they give us usually a portion of the virus. It is harmless because it is not the full virus, and it allows our bodies to recognize this COVID without, again, injecting the full virus into our bodies, and then start producing antibodies and immune cells that will be there and ready to recognize COVID when and if we are exposed to the real disease in the future. So it's actually just readying us up and to be able to fight off these bad germs.
And with the vaccine, does it make it so you will not get or be able to spread COVID, or how does that part work?
So for COVID specifically, these vaccines will make you much less likely, if you were to get COVID, to get the severe form of COVID. So basically, they do prevent you from getting COVID for sure, whether you have symptoms or not. But even in the small chance that you do, because nothing is 100%, of course, these studies, all of the studies on all three of those vaccines that we're hearing about right now, have shown that even if you get it, you will not get the severe form of COVID, where you have to go to the hospital or even die because of COVID. So this is what's actually significantly reduced by the vaccine. Is one, you're much less likely to get it, and even if you get it, you are very unlikely to be hospitalized or die from the disease.
And are you still able to spread the disease if you have the vaccine?
So we have preliminary data from the studies that show that you are less likely to be infected without symptoms, so asymptomatically infected, what we call, if you get the vaccine. Is that number zero? It's not zero, but that is very reassuring in terms of the fact that when you get vaccinated, you are potentially less likely to transmit to others. Again, there's nothing zero in this world, but it is definitely reassuring data. We continue to monitor the science, and if anything is updated, we will, of course, let people know. But the preliminary data seems very promising.
So even after someone gets their vaccine, it's still incredibly important to continue the social distancing measures and all the precautions that are set in place, right?
Right. I think for now, as long as the majority of the people are not vaccinated, we still do not want the vaccinated individuals to go around without masks and social distancing. We are still in the pandemic, so there's a lot of disease out there. Even though the numbers are improving, there is still the potential for another surge. We have been through 3 surges right now, and even with the great improvement history has taught us from the past year that as one surge goes down, we might expect another one. So as long as we are living in a situation where the majority of the population is not yet vaccinated, we need to be taking care of each other. And even though we are protected for ourselves, we need to make sure that we are not carrying any chance of passing this along to others who are unvaccinated. This will change with time. Once most of the population is vaccinated, that's definitely going to be, there's going to be definitely a change in these recommendations.
Mm-hmm. And then when you say most of the population, is there like a percentage amount that science kind of backs up as like it's better now, or what does that look like?
So that's a good question. And the real answer is we don't know, because this is a new virus. So we have never had a vaccine for this virus specifically to know the exact number of people that need to be immune before we stop the ability of having these major outbreaks or major surges. So really, that what you hear about in the media and from Dr. Fauci and others about that number being 85% is an estimate really from the experts. But we are waiting to see whether we will reach that herd immunity level if we get to 80 or 85% of the population. This is what experts are predicting, but it might be higher, it might be lower, so we'll see. And that number is what's called herd immunity. It signifies actually the beginning of the end. So once we reach that level where we are, let's say, assuming 85% is the number, 85% of us are immune, then we start our real hope that we are turning the corner, because that's when, even though there might be COVID in the community, there's definitely much lower risk of having these major outbreaks and major surges, even if we still are seeing some cases.
And you mentioned a little bit, we're not in a surge right now. Do you think that the vaccination efforts we've been doing have helped with that, and the numbers we are seeing at the Indiana State Department of Health numbers? Is there any relation that we can see yet between the vaccinations and the numbers we're seeing?
So that's a great question, and the quick answer is it's many factors together. We actually don't know what's the main driver behind the drop in the cases. Actually, none of the experts are able to predict why and when these surges just die down on their own and then they start back up again. So because this is a new virus, we don't know much yet about it. As much as we've learned, we still have a lot of unknowns, and this is one of them. Certainly, there are factors that we think are playing a role. One is people distancing, masking, being more careful. Two, definitely vaccination. We should start seeing soon that vaccination is starting to reduce the number of infections in those who are fully vaccinated. But again, right now, we are starting to be in the phase where people who started getting the vaccine have gotten the 2 doses and are beyond the period where they are non-immune. So remember that when we started in December, there are certain people that were not immune until January. And those people who got vaccinated in January, they have not been immune until now, potentially. So as more and more people are getting vaccinated and have gone through those 2 weeks period after the 2 doses, then we are expecting to start seeing an improvement in the number of cases in those specific age groups that are that have been eligible for the vaccine. We know from outside of the United States, from countries that are vaccinating at much higher speeds, that they have already started seeing a significant downtrend in the number of cases in vaccinated vaccinated individuals. So we are expecting in the United States to start seeing that downturn. Also yesterday, there was a report about nursing home infections precipitously dropping to more than 80%, and then the deaths dropping by more than 60% because of vaccinations. So we definitely have evidence that these vaccinations on a population level, not only in the clinical trials, are showing what we expected them to show, which is less disease, less illness, less hospitalizations, and less death.
Excellent. And then you kind of mentioned in it, there's a window after the second dose. Why does it take 2 weeks for the body to really develop that response? And is that standard?
Yes, this is standard, and usually it's faster when the vaccines are one dose, obviously. So if you get the flu shot, usually you get your immunity a few weeks after that one shot. But because these vaccines, the Pfizer and Moderna, require 2 shots to get your body fully ready to fight this infection, this is why it takes a little longer than just 2 weeks after the shot. It's actually 2 weeks after the second shot when you start getting your immune system ready. So that's very standard. And the reason for this is, remember, your body needs time to recognize that vaccine or that protein that we put in the vaccine. And it takes time to start building up all these antibodies and preparing them and training them. So that's very standard and not unusual. And that's why some people might still get COVID before that period, even if they've received the first dose of vaccine. So they have to continue to be very careful because they will not be immune until those 2 doses and 2 weeks after have passed.
And so with some of the other vaccines that in the next upcoming weeks that we'll hear about, for example, the Johnson & Johnson is supposed to be a one shot.
Right.
How is it only a one shot compared to Moderna and Pfizer? What makes it a one shot?
So it's more that it acts differently, and the way it was designed or the way it works requires it to have only 1 dose versus the others require 2 doses of the vaccine. So it's mostly based on the how it works in the body and what level of immune response it can produce. So for this one, they were able to develop something that would give us enough immunity just by giving 1 dose versus the others you required kind of a second dose or booster shot to give it a push or a kick. And that, is also standard. That's nothing unusual. There are some vaccines that we give only 1 time. There are vaccines that we give 2 or 3 shots even. So hepatitis B is one that we have to give 3 shots to get your body the full immunity. And we've been using this vaccine for such a long time. So it's more nothing serious or nothing that would indicate that this one is better or less better because it's a 1 dose versus a 2 dose.
Mm-hmm. And it's just because it's a different type of vaccine.
It's a different type of vaccine, and every different type of vaccine is manufactured in a way. Some of them produce an immediate strong antibody response. Some of them require multi-dose regimens. Some of them are, you get them once and you don't have to repeat them for your life. And sometimes some of them, you have to repeat them depending on what infection you are targeting.
And if someone has, this kind of goes into the next question. So when it comes to prioritizing the vaccine distribution, this week in Indiana, the age was reduced down to 60 plus. Right. How is this decided, and when will we start seeing more of the phases coming in?
Right. So this is decided at the state health department level. There is a committee that is formed of experts in multiple different fields that looks at the data and tries to decide on the age-based groups based on factors that they've taken into consideration. For Indiana as a state, and I think that to me that was, one of the greatest decisions that they've made is they wanted to reduce and stop suffering and death in Indiana. And the way they looked at it was, okay, let's see who was suffering the most with death and hospitalization. And they found that the older age groups and those people with certain comorbidities are the ones that are going to the hospital at much higher rates and dying at much higher rates. So the goal for this committee was, how can we stop death and hospitalization and suffering in those individuals? And that's why they decided to prioritize those vaccines to those age groups. And the goal is to try to save their lives. These people will never have a second chance of life if we're not giving them this vaccine. So that is why they are going through the age-based approach. Now, if we had all the supply in the world, everyone should have been eligible who's 16 or 18 years and older for the vaccination. So it's not about medical, who should get it or who shouldn't get it. It's more about, we have limited supply, so let's give it to those who are dying and losing their lives. And then we will move on to afterwards to people who are at lower risk. I think that, the State Health Department mentioned that by their data, those who are 50 and older constitute 98% of the COVID deaths that have happened in Indiana. So by the time we reach those age groups, we would have covered everyone who would have been at a very high chance of dying. Also, it constitutes people who have 82% of all the comorbidities in Indiana that put you at high risk for COVID. So I think this age-based approach was targeting both age and other comorbidities very, very nicely. And hopefully we'll start seeing people's lives saved from this strategy.
And when it comes to people who have already had COVID, as we go down through the levels, because you've had COVID, your body still has that immune response, right?
Right.
And so if you've had COVID, do you still need to get the vaccine?
Right. So if you've had COVID, yes, we encourage you to still get the vaccine. And there are multiple reasons for that. We know that when you have a natural infection, not just an infection with COVID, you will potentially have some level of immunity up until 3 months only. And then we're starting to see people get reinfected with COVID. So the level of immune response that you're getting from a normal infection is not as reliable as the one that you can get from a vaccine that has been studied to produce certain outcomes which are preventing you from having severe disease and dying. So we would still encourage you to get vaccinated even if you have had a previous infection. And from a safety level, all of the trials have included people who've had a previous infection, and there has not been any adverse outcomes or anything negative come out of that, of them getting a vaccine even though they've had the infection. So I think about it as just making sure your immune response is stronger and more reliably higher so that it can prevent you from getting reinfections. Initially, you heard potentially people who have had infections to wait 90 days or those 3 months before they get the shot. And that's only because supply is very scarce. And in those first 3 months, you are potentially protected from getting COVID. So maybe allowing other people to get the vaccine first is a smart strategy. But first, after those 3 months have passed, you are back at potentially higher risk of infection. And also from a medical perspective, you can certainly get it today and you don't have to wait the full 90 days.
And if people are concerned, they're saying they're unsure, what's the best way they can ask these questions, and who should they be asking these questions to?
So unsure about the safety of the vaccine, you mean?
Just the vaccine and all of it, essentially.
Yeah. So I think going to your trusted source of medical information, which is your doctor, is probably your best choice or bet at getting the most accurate and reliable information. There's a lot out there, and it's hard to filter through what's good news and what's bad news and who's reliable and who's not. I think your doctor is someone who is medically trained to be able to give you a very informed decision. The CDC, the State Health Department, also has a lot of good information, and they are accurate and medically sound, that I think these are great sources to go to. For those that are hesitant, I encourage them to discuss those concerns. What makes you concerned about the vaccine with their doctors or people they trust, so that they can understand and have a better, more informed decision of their choice. And we can certainly talk about what the most common causes of the hesitancy are and how to address those if needed.
Yeah, can you just give as people, could you just give a couple, for example, and how going to your trusted physician can help you better understand the science behind vaccines?
Right. So I think it is a long discussion, and that's why it needs someone to actually listen to you, because you might have very legitimate concerns. The most common concerns I hear from people is they are very concerned about how fast these vaccines were developed. And I usually let people know that these vaccines were definitely developed very fast. They usually, vaccines and all medications, we wait months and months, sometimes years, to get to something efficacious. So certainly acknowledge that this was fast, but that doesn't mean that we cut corners to reach here. First, these technologies with all the vaccines that we are seeing right now or hearing about have been developed decades ago, and they have been trialed in different medical areas. However, when you have a pandemic, it makes it so much easier to combine efforts across multiple groups, multiple companies, and towards a shared goal. And that makes it much faster to be able to reach those good outcomes. The most important thing is that these vaccines went through all preclinical and clinical trials that any vaccine or medication that you are taking right now would go through. All the rigorous steps were followed. It was just easy to recruit people, to those clinical trials. So usually as physicians, if we want to involve people in clinical trials, we wait months and years, and people usually don't want to participate because it's just a lot of work on their part. For this, people were super excited to participate in clinical trials. So it made it so much faster to enroll these 40,000, 60,000 individuals that we're talking about. Two, when we live in the middle of a pandemic, it is very easy to test the efficacy of vaccines. But if you have a very rare disease like Zika, Ebola, or even rarer diseases than that, like meningococcal disease, for example, it takes years to be able to establish efficacy because there's not really any disease in the community. So how are you going to establish that one thing is better than the other? When you are in the middle of a pandemic and you have thousands of infections, it's very easy and fast to establish if there was a difference or no difference in the outcomes. So I think production was also encouraged to occur before we had the FDA approval because of how good the results were. Usually the process is you wait for FDA approval and then you start producing vaccines. Here, because we were in a pandemic, these companies were given the okay and the funding needed to start producing based on their preliminary data, and they took the risk on that before the FDA approved the drug. Obviously, there was promise, there was good data behind that before they started production, but usually that's one step that happened before the FDA approval that sped up the process significantly. The other thing is people talk about safety, and in the past they said we want to wait to see what other people experience outside of the clinical trials, and I can tell you now that we have 200 million people around the world that have been vaccinated, and we have data from the CDC about millions of individuals have been vaccinated, and there has not been side effects other than what has been reported from the trials, and nothing serious at all.
And if people do have symptoms or Those are explained during while they get their vaccine, correct?
Right. So all vaccine sites will be able to explain what symptoms to expect. These symptoms are usually, very mild. They're pain at the injection site. They are fever, headache, muscle aches, chills. These are normal. These are what you want your body to do because your body's trying to produce antibodies. Your body's working hard to make you antibodies, and that's why you get those side effects. So they're not really harmful. They're not permanent. They go away within 24, 48 hours, and they go away with Tylenol or any medications that you want to take to try to relieve your symptoms. But they are an indication that vaccines are working and not something that would permanently harm or damage your body.
Excellent. Dr. Dbeibo, as we start to wrap up, is there anything specific you want listeners to know or anything else you'd like to add?
Yeah, so I would say that these vaccines are exactly what we were waiting for to end this pandemic. And we all need to know that they are safe, extremely effective. They're going to prevent hospitalizations and deaths. And I think we're tired of seeing people that we know and love suffer from this illness. I think they are our only way out to the normal. So I would encourage people to get vaccinated. I would encourage you, if you have any questions or hesitations, don't keep it to yourself. Don't feel bad about asking. Go to your trusted source, go to your doctors and talk to them about the vaccine. Talk to people you love about the vaccine if they have concerns, and get the vaccine as soon as you are eligible. It doesn't matter what vaccine you have available in your community. All of them are extremely efficacious. And I think picking and choosing at this point or waiting for this or that is not going to be in anyone's benefit. So the best vaccine you can get is the one you get today, and just get it as soon as you are eligible.
To hear more information from Dr. Debeibo, you can go to RadioNOWindy.com to listen to our first conversation. If you have any questions or topics you would like me to cover, please email me at emetheny, that's EMETHENY, at radio-1, that's ONE.com. Or you can message me on Twitter at EmilyDoesVideo. Please join me again next week, and until then, have a great week.
Radio Now 100.9's Indy Connection with Emily Metheny.